Hello class, this is Mount Kenya University School of Nursing and the unit is Fundamentals of Nursing Practice 2, unit code BMS1301. You're welcome. My name is Lucy Waweru. You're welcome. Lesson objectives. Our objectives are, by the end of the lesson, learners should be able to define nursing diagnosis, outline types of nursing diagnosis, describe characteristics of nursing diagnosis, and differentiate between nursing diagnosis from nursing or from medical diagnosis. And finally, the learners will be able to formulate nursing diagnosis statements. Introduction. So our topic is nursing diagnosis, which is the second phase or step of nursing diagnosis. Remember that we had done phase 1 or step 1 of nursing diagnosis, of nursing process, and now we are doing step 2. Step 2, which we said is nursing diagnosis. And nursing diagnosis is a process of reasoning or clinical act of identifying clients' problems. The purpose of this step is to identify healthcare needs of clients. Then after identification, we formulate nursing diagnosis statements. And this nursing diagnosis statement is as a result of analysis done on the information we got from step 1, which is assessment. And the assessment of our clients, we remember that we're doing the physical examination, we would have done the history, and then come up with information or data. That data is then analyzed. After analyzing the data, we come up with a problem, which we call nursing diagnosis. We have 4 types of nursing diagnosis. We have the actual nursing diagnosis is a clinical judgment of a problem that is existing currently, which the problem we identified during assessment, and it is verified by the presence of the signs and symptoms. And these symptoms have characteristics which we can explain or we can identify, and the symptoms and the signs gives us that very nursing diagnosis, which the nurse is able to intervene. Second is the risk diagnosis. Risk diagnosis is also a clinical judgment. But in this case, the problem that we identify is not present. The problem doesn't exist currently, but it is potential. It will happen if something is not done. If an intervention is not done on this, the client has a risk factor. We identify risk factor during the assessment, either by history or by the physical examination. Our objective data or the subjective data are informing us there is a problem that is likely to happen and something needs to be done before it happens, and that is a risk diagnosis. Then we have the wellness diagnosis. The wellness diagnosis is also a clinical judgment about a client, family, or community, which informs the nurse that there is a level of higher wellness. The client or the community, they are aware about their wellness, and they are seeking to do something about their health wellness, and they're asking, what can we do? Is there something that we can do to prevent or even to make our health better? Here, before giving a diagnosis of wellness, two factors must be present. Number one, an individual, family, or the community must process effective present function or status and show a desire for increased wellness, meaning that they must have shown that they are already well. And then from that status, they are seeking to be, to improve or even to prevent disease. That is a wellness nursing diagnosis. And finally, in the types of nursing diagnosis, we have syndrome. Nursing diagnosis, syndrome. And syndrome, nursing diagnosis statement, is still a nursing clinical judgment. The nurse judges from the information or the assessment that we get from the patient through our assessment. And this nursing diagnosis is associated with a cluster of predicted high-risk factors or actual nursing diagnosis. So here we're having the two, the actual our factors that are the information that we got from assessment, and it is telling us that the patient has actual nursing diagnosis or high risk. And they are related to a certain situation or event. Certain situation or event. There are 5 types of syndrome diagnosis. These are examples. Post-rape trauma syndrome. And when talk about the post-rape, consider this client. After rape, there is the physical injury that you could see. There could be bleeding. The cuts are there. Besides that, this is a situation that the client is having psychological issues, and therefore it is not just one thing that the nurse is dealing with. You're dealing with a whole situation. There is the HIV issue, there is the psychological anxiety issues, and then you have a physical injury. And that is why it is a syndrome diagnosis. It is not one thing, but you're dealing with, it's coming from a situation out of an event that occurred, and it makes it a syndrome. Then we could have relocation stress syndrome, and this is an example of like somebody has gotten a transfer and is not able to cope. And in that situation, there's the economic issue, there's stress, the psychological issue, and all the issues that are surrounding that. It could be actual or risk diagnosis. Then going back to the rape issue, we could have the rape trauma syndrome. Already once, the first one we explained is the post-rape. But when the client comes, we meet the client is already in that mess of rape. They have just arrived from wherever the situation was. And then they have all the issues I explained about the psychological, the physical, and many issues that relate to that. Then we have impaired environmental interpretation syndrome. Impaired environmental interpretation syndrome. For example, of such is when that the client or even students, they could be told, we're not going to be in the skills lab today, we're going to Thika level 5 for our lesson. And then they interpret that you want us to get coronavirus. You want to get us to the hospital, we get HIV before we know how to protect ourselves. Rather, they forget that, they misinterpret what the teacher or the one that is taking them through the learning, that it is not meant for punishment, but it is meant for their good. So, environmental, and there could be more examples. And finally, we have the disuse syndrome. Disuse syndrome. This is a diagnosis whereby maybe, for example, a patient has been on traction because of fractured femur, for example, and they are not able to, they cannot use the limbs. Because of that disuse, you'll have many diagnoses or problems that the patient could have out of the disuse of the limbs. Let's look at activities in diagnosis or activities involved in nursing diagnosis. In this step, we have activities that we must do for us to come up with a nursing diagnosis statement. And the activities, number one, we have to analyze data. Analyzing data. Number two, we have to identify health problem. You realize from the data from the assessment, when we analyze, we are coming up with a specific problem. The specific problem that the nurse is able to solve or intervene, either in collaboration with other healthy team, all independently. Then after identification of this problem, the problem could be a risk problem, or the actual. Number three, activity, formulate diagnostic statement. Formulate diagnostic statement. We have to, after analyzing and identifying the problem, then we come up with a statement. This is like a statement of the problem. And it is a statement that we don't just formulate the way we want or the way we know, but depends on NADA. We had mentioned earlier the NADA issue, NADA Nursing Diagnosis, which is the North American Nursing Diagnostic Association. And then after they give us that NADA, gives us the statements. And we connect now our assessment data, analyzing it, coming up with the problem, and then we look at the list of NADA diagnosis, which one fits your assessment data, and then you state it down. Let's look at number one, the analyzing data. Analyzing data. In analyzing data, we look at data that we got from our assessment and we compare it against the standards. For example, the patient's temperature. For us to say there is a problem, we have to compare the temperature taken from the patient with the standard. What is the normal temperature of a human being? Can we say now there is a problem after assessing? The other thing, or the BP, blood pressure. If we measure the blood pressure, then we have to compare what is the normal range of a blood pressure. Then, after we have compared and we find that there is a problem, it doesn't match the normal, then we cluster the cues, meaning this patient maybe is having a cardiovascular problem. This cardiovascular problem, you cannot just say BP alone. You'll have to justify or look at a number of things to say that the patient has a cardiovascular problem. For example, if there is a heart problem, we'll have to measure a number of things. There could be a cue from the history, it's telling you something. Then you measure the BP and the pulse is telling you something. And then we cluster those cues from the history, from the physical examination, from maybe laboratory, and something is telling us there is a problem. For us to be specific and say it is a heart problem or cardiovascular, we need a number of cues. And the cues, for example, are the symptoms. They are the data that you get from subjective and objective and laboratory issues. Then we relate them. And we make a meaning and put them as a cluster of symptoms. So that is clustering, and that is analysis of the data. Then we have number two, identification of the gaps and inconsistency which could arise from maybe the measurement error. You have used a BP maybe that had low batteries, or the patient could have been anxious, like what we call the white lab syndrome. The patient comes into the clinician and finds, just looking at that white lab coat and scared, and the BP shoots. Or there could be unreliable reports. maybe the report that you got from the patient himself was not accurate and could not be relied upon. Or the other example is expectation. You expected this. You expected maybe a high, this is a renal issue. You think the patient, after analyzing your data, you think the patient is having a renal problem, but then doing a renal function test in the laboratory, the two don't match. So we need to identify the gaps before we make that nursing diagnosis to be accurate. In the identification of the health problem, we say that it could be a risk or an actual, and then we want to see the risk, the strength of this data that we have taken, the very information that we get. What's the strength that is telling us that surely this problem is existing? And in the primary decision of making the process of decision making, it must include the nurse and the patient or the client. And here we are determining the problem, whether it is actual, risk, or a syndrome. Then we want to determine whether the problem is a nursing diagnosis or it is a medical diagnosis. And again, we want to determine the strength and then establish the source of the ability to cope. What is the source of this problem? What is the strength of evidence that it is there? And then, can the patient, how much is the patient able to cope with this problem? And then we have, after that, now we need to really ask ourselves, is this a nursing diagnosis or is it a medical diagnosis? Because if you are dealing with a medical diagnosis, the nurse will not be able to solve. For example, it could be a surgical problem, and that is not our jurisdiction. Then we'll need to refer it to where it belongs. For us to do that, there is a template we use, looking at questions that we need to ask ourselves to come up and to be sure that this one is a nursing problem. Because we need to really look at a problem that we can identify, that we can solve to save the life of a patient. So this is what we ask ourselves. For us to make the decision, we have a question that we ask to define whether this is a nursing diagnosis or a medical diagnosis, and the first thing we do is the identification of the significant queue or cluster of the problem. And the question we ask is, can the nurse take an independent or dependent action to treat the problem? And if the answer is yes, we go to the next question. And the next question we are asking ourselves, are this the primary intervention needed to solve the problem? The primary interventions, are they nurses' interventions or not? If they are not, if the answer is yes, then it's a nursing diagnosis. On the other side, question one, if the nurse can take an independent or dependent action to solve the problem, if the answer is no, it is a medical problem or it's a medical diagnosis. And the second question, if the medical orders are required to solve the problem, and if the answer again is, if the answer is yes, it is a medical diagnosis. So you have to be careful so that we pick what is ours and intervene, because if you pick the wrong one, you will not be able to intervene. Let's look at formulating nursing diagnosis. Formulating nursing diagnosis. In the formulating nursing diagnostic statement, which we said that it is a clinical judgment about a client or a family or community response to an actual or potential health issue, which could be a life-threatening, the nursing order, and then the nurse does the nursing order for interventions to reduce or eliminate the problem. And we have components of nursing diagnosis. Nursing diagnosis statement has components. Component number one is the problem, which we call diagnostic label, and we give it P. Then number two component is etiology, and this is what the problem is related to. What is it related to? Which are the causes, which could be psychological, it could be physiological, and the like. And we give it E. And we give it E. And then we have the defining characteristics of the nursing diagnostic statement, which includes the symptoms and the signs, and we give it S, standing for the symptoms. And the three of them makes the structure. Let's look at the problem. The problem is a concise description of the client's health, and it contains qualifiers, which is demonstrated or described or given by adjectives or a noun. And these nouns are, for example, deficient, meaning there is inadequate amount, or there is impaired health, which makes, or that means that the situation is making the function of maybe the organ worse or weakened. Another example is ineffective, meaning that it's not producing the expected. The definition of the problem. We classify them as a diagnostic label. For example, activity intolerance. And this is a state in which an individual has insufficient physiological energy to carry out an activity. Etiology. Etiology is related factors. The components of nursing, which is the components of nursing diagnosis, meaning that it contains one or more causes of the healthy problem. And it is put in the structure as related to. And it could be, I said, it could be physiological factor, hematological, or even pulmonary. It could be related to any of the symptoms or situations. Then we have the defining characteristics and the cluster of signs and symptoms, that these are the indicators. And the characteristic could be a risk of nursing diagnosis. Or there could be factors or conditions that cause the clients to be at risk. Types of the defining characteristics. We have the major, which are the major symptoms of a particular problem, or the minor. So for it to be really a problem, it must have at least 2 cues of the major symptoms of a problem. So according to the nursing diagnosis classification, we have one nursing diagnosis, we have 3. A nursing diagnosis that have 2 parts, a nursing diagnosis that has 3 parts, 2 parts, 1 part and 2 parts and 3 parts. For the one that has 1 part, it means the nursing statement has only a problem. But the second one that is having 2 parts, it means that it has the problem, which we call P, and then accompanied by etiology. Then number 3, we have one that has 3 parts. It is having all of them: the problem, the etiology, and the S, the symptoms. For this country, for Kenya Nursing Council, we embrace the one with 3 parts. According now to the nature of the client's problem, the actual clinical judgment that the problem exists at the time, one could have, for a possible nursing diagnosis, for one that is actual, we could have one which has the evidence. The evidence is the signs and symptoms. And the etiology is where the problem is coming from. What is the etiology? Where is it coming from? And the risk problem is the existing, the existing factors, risk factors. Let's look at an example of one statement, nursing diagnosis statement. Imbalanced nutrition, less than body requirement, related to decreased appetite, nausea, and evidenced by weight loss of 4 kilograms and muscle wasting. So in this one, the first part is the problem, and the second part is related to, is where the problem is coming from, and the third part is evidenced by. So those are I will send to you some more examples. I'd like, for example, one that is for malaria. And then finally, we need to document. After we have done all that, we need to document, because we said what is not documented is not done. Record is very important in nursing. You need to refer to the basic the data that you took, and it will help us even to evaluate our patient's progress. In summary, we can say, like, we have looked at nursing diagnosis as the second phase of nursing process, and we have said it's a clinical judgment by the nurse coming from our first step of nursing assessment. We have also looked at the types, and we have looked at actual, risk, wellness, and syndrome. We also looked at the components of nursing diagnosis, and we have abbreviated it as PES. P for problem, E for etiology, and S for symptoms and signs. And then we have looked at the characteristics of nursing diagnosis, which we said must be concise, and data is from the assessment, and then it helps us in the planning and intervention. We looked at the activities in the nursing diagnosis, which is analysis of data, identifying the problem, and which the problem could be risk, and we have to look at the strength and finally do the formulation of nursing diagnostic statement. And then we have differentiated between the nursing diagnosis and the medical diagnosis by asking ourselves whether the interventions required are nursing interventions. And then we have done the formulation and we have looked at nursing diagnosis statements, which are 3 types. One that has part 1 part, second that has 2 parts, and the third one that has 3 parts. And we have said for this country, we embrace the one for 3 parts. This is, we've come to the end, and I hope we appreciate nursing diagnosis phase, which really helps us to come up with a problem, and this problem is the basis for our nursing intervention.
These televised lectures supplement our robust online learning going on our MKU online platform. You can view more on our televised lectures via our online platform. We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then email all the above to apply@mku.ac.ke.